Hi everyone. In this video, we are going to learn about the fire safety in the hospital. It is a part of patient safety. I am Jenlyn Bernard, working as tutor in MMM College of Nursing. This video will be helpful to understand and gain knowledge about the need for fire safety, risk factors for fire accidents in the hospital, fire safety plan, different types of fire extinguishers, and the role of nurse in fire safety. We all might be remembering the fire accident which has happened at Arwadi. There was a mental health care unit with lot of inmates. In that, few of them were bonded with the chain. Unexpectedly, one day the fire accident was happened. Those who were restrained with the chains were not able to escape. They were burned and died. So it is highly important to think about the fire safety precautions in the hospital setup. Why the fire safety is important in the hospital? When patients are getting admitted in the hospital, most of them are highly dependent, especially the patients those who are in the life support equipments, post-operative patients, those who are on tractions, and also the vulnerable group like newborn babies and the elderly patients. So it is highly important to think about the prevention of fire incidents in the hospital. Now we can see the risk factors which can cause the fire accidents in the hospital. Oxygen and nitrous oxide gases, flammable chemicals like surgical spirit, electrical equipments, natural gas which has been used in the kitchen. All the building should have the fire safety plan. Along with the building plan, there must be a fire safety plan. It has to indicate where the fire extinguishers were kept and which is the way to escape, and also it should mention about the fire assembly point so that in case of any emergency it can be used appropriately. Now we can see some common fire safety measures which is used in the hospital. There should be an adequate number of fire extinguishers and it has to be distributed to all the floors. The first aid kit has to be maintained appropriately. All the expired and used items has to be replaced promptly so that in case of any emergency it will be available to usage. Fire alarms has to be installed in all the floors. There should be a water tank with separate hose reel for all the floors. So in case of any huge fire accident, it will be useful to put off the fire on time. The fire station number has to be displayed on the emergency telephone number on the notice board. So in case of any emergency, people can call and get the help. The hospitals has to conduct the fire drill. There should be a proper planning and preparedness that has to be practiced through fire drill so that the staff members will be skilled enough to act smartly to put off the fire and save all the human beings in case of any fire emergency. Firefighting training should be given to all the staff members, irrespective of their cadres and what position they are, so that in case of any emergency, they will be skilled in handling the fire extinguishers and rescue the patients appropriately. Fire safety measures in the hospital. There should be fire detection and alarm system, gas suppression system, water-based firefighting system, fire extinguishers, life safety, passive fire protection, fire hazards identification. Now we can see the different types of fire extinguishers. The very common one is the water. Very safely it can be used on wood, paper and textiles, but it should not be used on electrical equipments, flammable liquids and the flaming metals. Dry powders. It is suitable for all kind of fire accidents. It is very safe to use on wood, paper, textiles, flaming oils, gases and the electrical equipments. Carbon dioxide. It can be safely used on flaming liquid fires and the electrical fires, but it should not be used on wood, paper and textiles. AFFM spray. It can be safely used on wood, paper and textiles and also the flaming oils, but it should not be used on electrical equipments and flammable metal surfaces. Fire blankets. It is used to cover and put off the fire. Wet chemicals. It is safely used on paper, textiles, wood and cooking oils and also the deep fat fires. But it should not be used on the electrical equipments, flaming liquids, flammable gases and other surfaces. And we need to take a caution that the nozzle is not touching the fat or flaming oil. In case of fire emergency, we have to remember raise and pass. Now we can see one by one. Raise, that is rescue, alarm, contain, extinguish. Rescue anyone in immediate danger of fire. Alarm, pull the nearest fire alarm and call fire response. Contain, fire by closing all doors in the fire area. Extinguish, small fire, if not leave the area and close the door. The same thing in hospital, we should remember to remove the victim or patients immediately from the danger and report the fire location by activating the fire alarm. Close all the windows and doors to isolate the fire so that it will not be spreading to the nearby rooms. And if the fire is small enough to put off with the fire extinguisher, use the fire extinguisher to put off the fire. In case of fire accidents in the hospitals, for each floor and each ward, we have to evacuate the patient. So the people, those who can walk, can be taken by walk, and those who need the wheelchair or with the walking aids, they have to be gently removed from that place. And also we have to take care of the bedridden patients. They can be moved along with the bed, and we have to take care, or we have to remember the life support equipments, oxygen, saline, everything should not get interrupted. Next we can see about the pass, that is pull, aim, squeeze and sweep. When we are using the fire extinguishers, use the technique of pass, that is pull the pin to unlock the extinguisher. Aim at the base of the fire. And we have to stand around 6 to 10 feet away from the fire and squeeze the lever to discharge the agent which is filled inside the cylinder, and sweep the spray from left to right until the flame are totally extinguished. When the patients are getting evacuated from the ward in charge and the assistant will be acting as the fire matron and the assistant matron. They have to ensure all the patients and the staff members were left the risk area and they were assembled in the fire assembly point. And they have to check all the patients, whether all patients, staff members have been rescued safely or not. Now we can see the role of nurse in fire safety. The knowledge about the types, operation and location of fire extinguishers is highly needed for all the staff members. The preventive measures are highly needed than we are managing the fire accident. Plan, prepare, and practice the fire drill. Smart action in fire management is highly needed to save the patients. Frequent fire safety audit has to be conducted. Ensure the patients are safe. The reference were taken from the nursing textbook and also from internet. Thank you for listening.